Our children are facing a mental health crisis. At least 1 in 10 kids is struggling to cope. A Panorama Freedom of Information request shows that at least 1.5 million children in England don't have access to round-the-clock specialist support. Could Jessie's crisis have been avoided if she'd got help earlier? CAMHS are rejecting more children now than 5 years ago, and child psychiatrists are deeply concerned. Is CAMHS fit for purpose?
I have colleagues working all over the country who are extremely dedicated, extremely committed, doing excellent work. The trouble is the services are very stretched. We're not meeting the needs, so in that sense it's not fit for purpose.
Only 1/4 of children with mental health problems currently get treatment. The government wants to improve this to 1/3, but that to me is still just a target to fail. They promised an extra £1.4 billion for CAMHS, so where's it all going?
In too many cases, money just isn't reaching the front line. Young people's mental health budgets for too long have been raided to pay for other parts of our National Health Service. And we all know the pressures that our NHS is under. But I believe urgently we need to see those monies protected and ring-fenced.
This feels like a double blow, extra money being announced, but with no guarantee it will be spent on our kids. So a short-changed CAMHS having to ration care? Well, during our investigation, we were passed a leaked letter from one London service that is doing just that. Staff were told in January they could no longer treat everyone who needed help, apart from the most severe cases, like kids with psychosis or those who are seriously self-harming. The CAMHS professional who sent us this letter said it's a shocking state of affairs. It's hard to argue with that. And we're told that this sort of thing is happening in other parts of the country as well. The leaked letter came from Waltham Forest CAMHS. They told us the restrictions on care were fully lifted again this month, adding, "We do not underestimate the level of challenge we face." I spoke to a whistleblower who worked in CAMHS for decades. She got so fed up that she left, but still works with ill children and wanted to remain anonymous.
My experience in the past 8 to 10 years has been a real deterioration in children and adolescents' ability to access services. The thresholds have changed considerably. We've been expected to mop up cases which are in very, very difficult states. It really isn't good enough when you think if we could have seen them earlier, when it's actually the service that's stopping that access, that's a real crisis and a catastrophe.